Yeah, pelvic floor muscles are group of muscles located in the pelvis between the tailbone and the pelvic bone. So you can feel the pelvic floor muscles if you try to stop the flow of urine. So whenever you go to toilet, you can feel that. So these muscles support and protect your bladder, large intestine, rectum, anus, penis, or vagina, prostate, and uterus. So it protects the pelvic organs. In that ways, protects as well as support. It provides the support to these pelvic organs. In general, we call this pelvic floor exercise as very well known as Kegel's exercise. It helps to strengthen the pelvic floor muscles, and this gives the two major benefits. Like it is very useful to treat the urinary incontinence and to treat the pelvic organ prolapse in female. So we advise this Kegel's exercise for both the conditions, especially like urinary incontinence following QRP and HOLEP. We advise them to do Kegel's exercise, and similarly in female there is stress incontinence, even mixed incontinence. We tell them to do this Kegel's exercise. So beside medication, surgeries, diet, lifestyle changes, pelvic floor exercise can benefit patients with bladder issues, bowel issues, and organ prolapse, sexual dysfunction, pelvic pain, patients who have undergone pelvic or prostate surgery, as well as conditions such as benign prostatic hyperplasia. So it is indicated along with this medication, surgery, as well as lifestyle changes. It is very important. It is very important. It plays the important part in the management of this condition. In prostate, there may be incontinence of urine even after the prostate surgery, like TRP and HOLEP. There may be incontinence, so it helps. Kegel's exercise helps in providing the after doing this pelvic exercise. It is strengthened. There is a strengthening of the pelvic floor muscle, and that helps in the prevention and treatment of incontinence of urine. So these exercises are very important for the pelvic floor muscle that both support bladder and close the urinary sphincter. There is no fixed advice for this. It depends on the patient's condition. So doctor's advice is most important. So what we advise, at least 3 sets of quick and prolonged exercise, then slow and fast exercise, at least 3 times a day can be done. So we in general, for layman's term, we tell them to do 40 to 50 times in a day. In one set, around 10 to 15 times, they can do this pelvic exercise. This Kegel exercise, there are different ways to do it. It's a sort of yoga, and we should do it regularly, especially for female population. I will advise, in our female population, there is a lot of stress incontinence problem is there, and they are not coming out with this problem. So because of social stigma. So ideally, I think Kegel's exercise should be taught to our population, and as a yoga, we should do this. That will help in the development and strengthening of the pelvic floor muscles. So at least we tell them to do 10 to 15 times, means one set. So around 5 to 6 times. So total around 50 to 60 times per day they can do this exercise. Yeah, this is very important. You should not feel pain. It's a sort of yoga, so we should not feel any pain while doing the Kegel's exercise. And if you have pain, then contact your doctor. And at this point, they should consult a doctor and can discuss the technique what they are doing. There is some mistake in the technique if there is pain. Second, there is uh, don't do Kegels exercise too vigorously and not for prolonged time. Like many people, they are so whole day they are spending on Kegels exercise and can get exhausted. So it should be done properly. And another important point, if patient is on catheter, then this Kegels exercise should not be tried.